I think it was a project in 2005 was the first piece of research I did looking at autism, and it was looking particularly at what outcomes children and young people want from using services, and that was healthcare, social care and education. And we looked at what they wanted in terms of those outcomes, and we compared those, their aspirations and priorities, and compared those to children with complex medical needs and children with life-limiting conditions. I'm doing two projects on autism at the moment. My first project is in partnership with the Institute of Psychiatry, and they have a programme grant looking at improving mental health outcomes for adults with autism. And the project I'm doing within that programme of work is looking at how young adults with Asperger's syndrome understand their mental health experiences and difficulties within the context of having a diagnosis of autism. And then the second piece of work I'm doing, which I'm speaking about at the conference today, is we are doing a national evaluation of something called specialist autism teams. And they are a model of service provision that NICE, the National Institute for Clinical and Care Excellence, recommended every locality have, which is a kind of holistic, multidisciplinary service for adults with autism. So we're not finished, so I'm going to have to be a bit limited in what I can tell you at this stage. Findings come out in the summer. We have completed a piece of mapping work where we try to identify across England what localities, that's local authorities in partnership with CCGs, what localities are actually providing this specialist autism team service. And that means a single service that is doing diagnostic assessment, needs assessment, providing specialist interventions, and also ensuring and supporting people to access other services. So it's a very kind of comprehensive provision. So we just found 16 localities across England who are doing that at the moment, and most of those have been set up in response to both the NICE guidance and the Autism Act. So there's evidence, I suppose you can say it's doable. There's evidence that you can get the NHS and local authorities working in partnership and jointly commissioning provision. However, these are services which are small, and so the extent to which they are in their current model able to cope with increasing numbers of referrals and building numbers of referrals is questionable. So there's certainly a concern about, unless these services access more resources and receive more funding, the extent to which they can scale up in terms of demand. Now, one way these services are currently kind of rationing access is by only, for some services, you can only get access to this service through the diagnostic pathway. So that's good. That's good if you're an adult seeking a diagnosis for the first time, and there's some very good practice within that. If you've been diagnosed with autism already, perhaps in childhood or perhaps 20 years ago as an adult, in some localities you still cannot get access to that specialist support as an adult living with autism, and so that's a concern. All these services want to be doing more. It's around the resources they're being given. And that's why our evaluation is so important, because if we can show evidence of their benefit, then that's something that commissioners will be interested to read about. Within the study, we are comparing the experiences and outcomes of individuals who receive help through a specialist autism team and individuals who only attend a diagnostic and assessment service, which is what around 50% of localities now are able to offer people. And we're interested to know about their outcomes. Does it make a difference having the kind of more comprehensive support? And we're still doing the analysis on that data, but I can share with you findings from our interviews with people who've either gone down either of those pathways. And what seems to be different about specialist autism teams is the depth and duration of what we call psychoeducation in support, learning about what is autism, what it means for me, and how I'm going to live with it. Now, those teams have a capacity to do that over a number of sessions, offer opportunities for group sessions, whereas the diagnostic services, by their nature, only can give that in a very limited way. Now, what we found in our interview sample, we need to confirm this with our wider quantitative data, is that For those who who got the brief psychoeducation from the diagnostic service, 12 months later on, some of them were still very unresolved about the diagnosis they'd received. I'm not placing blame on those diagnostic assessment services because that's all they're commissioned to do, and I think they would want to do more, but it does highlight that issue. And that's important in itself, but what I think we're also seeing on our interview data is if that isn't dealt with and people are resolved and start to make adjustments, other needs, in a sense, will remain unmet if people haven't reconciled or accepted the diagnosis, or it is troubling them a lot. Other mental health issues, for example, will remain under-addressed. So there's a concern there. So that's one finding I think that's important, that we feel certainly is something that has real implications in terms of future practice. The other thing, I'll just pick a second one just for now, is what we've learned about how people who've been diagnosed with autism, what they do when they're given information. So it's that sort of thing about signposting. And a lot of them don't do anything with it. So just providing a leaflet is unlikely actually to do anything or be any help to people. And in fact, if that's all you get, it actually has a negative impact, an additional negative impact on people, a sense of abandonment, which adds to everything else they're having to process at the time. So I think there's real questions about just handing out leaflets, just signposting. Some individuals are going to need support to help them access whatever services they're being signposted to in a more active way. Again, services working under constraints of resources. So I think that's something else that certainly we need to look at in the future. So one of our partners, the members of the research team, is the National Autistic Society. We're very keen to have them as partners in the research from the beginning. And they've been really good about helping us be aware of opportunities along the way of the project, but also planning what we can do to maximise the impact of this research. Now, the fact that research is coming to an end in the 10-year anniversary of the Autism Act and all the activity that's going on around that means there's going to be lots of platforms and forums for us to share our findings, which is very exciting. We're also going to be working hard to make sure that our findings are produced and shared in ways that are meaningful to the people we're speaking to. So what commissioners want to hear is going to be different to what a service manager is going to want to hear, and what people in the autism community themselves want to hear, they might want it differently again, or what's important to them or the implications to them will be different. So we'll be doing work around tailoring our findings and sharing them in ways that are meaningful and I hope helpful. And then we'll also be submitting evidence from the study to NICE, who will be reviewing the NICE guidance in 2020. And we have already alerted them to the studies going on, so we expect that will be evidence they'll take on board when they revise the guidance. I think the issue for mainstream service is that a specialist service is a specialist service, and specialist services shouldn't be delivering services to lots of people. So one of the role of specialist services is that part of their role and part of their job is, and this is what these teams are all doing, is what we call upskilling mainstream services so that they can better deliver interventions and support themselves. And in a sense, there is a need for mainstream services to take that on board, be that IAPT within NHS mental health provision or local authority social care. So a willingness to be upskilled, a willingness to take referrals of people with autism rather than always pushing them to the specialist service, which, given their size and the nature of them, that's not a sustainable model. As a researcher, I have a responsibility to make sure I share my findings in a way that the autistic community can use them, because they are the best lobbyers, the best advocates, but they need support and resources to make their arguments, to shift the minds of policymakers or local commissioners. And I think that's in a sense, that's the role of research, is to provide those resources and information and evidence that then the community, with our support if they want it, can then make those cases made. And I've certainly had experiences of that with other projects where it has evidence that we've produced as a research unit has been taken and has resulted in significant changes, because it was actually parents in that project who took it to their governments around the UK and which generated changes in policy.